I'm supposed to talk on the embryology of the respiratory system. So with that, I have only 4 objectives. First is to describe the embryological movements of the respiratory diverticulum as it develops. Second is to describe the phases of the development of your tracheobronchial tree. Next is to describe the primitive body cavity and how it becomes into your pleural, pericardial, and peritoneal cavities. And then I will discuss some developmental disorders. Okay, so 7 years from now, as first-year students, so 7 years from now, when you are in your first-year residency training, and you choose to become pediatricians, okay? These are the cases that you will be faced with. Mga preemies, okay? This is what makes Dr. Isguera rich. Next, this is taken from Junquera 2005, okay? So this table will just show you the different phases of development. You have 5: embryonic, pseudoglandular, canalicular, terminal sac, and alveolar. When you have your embryonic phase, this is about 0 to 5 weeks of gestation, and generation here refers to the tracheobronchial tree branching. So all the way up to the end in the terminal sac, it's about 25 to 37 weeks of gestation, and you would reach 27 generations of subdivisions. Okay? So underneath here, you will see that in the embryonic phase, you will have the development of your trachea and partially the bronchi. Up to the canalicular stage, you will have the formation of your conducting airways, but it is also at the canalicular stage where you will have the development of your respiratory units. Okay? So taking the embryo at 4 weeks of life, the appearance and location of your lung bud, which is in the foregut, okay, depends on the increase in your RA factor, which is your retinoic acid. And this comes from the adjacent mesoderm, specifically the splanchnic mesoderm. Okay? Because of the increase in your RA, you will have an upregulation of your transcription factor TBX4. So what do you mean when you say upregulation? So because of the increase in your RA, your TBX4 has to respond to this increase. So what will TBX4 do? It will induce the formation, growth, and maturation of your lungs. So if you will take a look at this figure, okay, ito yung gut natin. This is the foregut area. This is the midgut, and this is the hindgut. And there is your lung bud here. Okay? Further development would show you the appearance of your pharyngeal pouches or your arches. Ito pa rin yung lung bud natin. Okay, so for the embryonic phase, what is the main feature? It's simply the development of your proximal airways, specifically the trachea and the bronchi. Okay? Remember, the lung bud arises at the level of your 4th pharyngeal pouch. Now, I'm sorry, yung TBX4 nyo pala comes from the endoderm. Okay? So remember, the RA comes from your mesoderm, TBX4 comes from your endoderm. And because of these arrangements, the internal lining epithelium of your larynx, trachea, bronchi, and lungs are of endodermal origin. Next, the cartilaginous, muscular, and connective tissue components of your trachea and lungs would come from your splanchnic mesoderm or your visceral mesoderm, which surrounds the foregut. And lastly, the cartilage and the muscular components of your larynx would come from the 4th and 6th pharyngeal arches. Okay? Now, during development, if you'll take a look at this one, So this would be your lung bud, and this would be your foregut. Okay? They are in open communication at the early stages of development. However, you will have the formation of your ridges over here, and these ridges will unite, okay, to form your septum, your esophagotracheal septum. And once you have the septum formed, then you will have the separation of your trachea from your esophagus. So the ending of your embryonic phase is you would have the lung bud with its two lateral outpouchings. Okay? Ito yung trachea nyo, ito yung lung bud natin. Okay? Just to let you know, the respiratory primordium at that time would also maintain communication with the pharynx. This is the adult na, no? So this is the pharyngeal area, this is your trachea, this is your esophagus. So it maintains communication via the laryngeal orifice, which is over here. Okay? Ito yung ventral view natin, this is your laryngeal opening. So after the embryonic phase, you go to the pseudoglandular phase, and the main feature here is the development of the lower conducting airways together with its vascular supply. This is at 5 weeks of development, 6 weeks, this is at 4, 5, and 6 weeks of development. Okay? So from the bronchial buds, okay, you will have your primary bronchi, and then you will have your secondary bronchi. You have 3 on the right and 2 on the left. And as the lung buds develop, okay, they will penetrate your coelomic cavity, which is also known as your primitive pleural cavity. And the name I will say later, it penetrates, you know, when you read Langman, they penetrate into the pericardioperitoneal canals. So during the pseudoglandular phase, you already have the differentiation, the beginning of the differentiation of your epithelium, which comes from your endoderm. So it is now assuming the simple columnar epithelium. And this starts at 13 weeks in a centrifugal manner. Okay, branching will continue. But remember, your branching depends on your epithelium-mesenchyme interface between your endoderm and the lung buds, endoderm of the lung buds and the splanchnic mesoderm. And the signals would come from your mesoderm calling the FGFF. This is your fibroblast growth factor family. Okay, while listening to Dr. Domingo, I got a chance to read at the trans yung mga previous years. Medyo may mga mali. Okay? So, your trans is, there's some data there which is not correct. Okay, so continuing with the branching, until you reach the 20th generation, in this phase, the first 8 generations would acquire your cartilaginous walls, and the rest would become your terminal and conducting bronchioles. Conducting meaning wala pa rin kayong respiratory bronchioles. Okay? So as it penetrates, it would be accompanied by your lymph vessels, bronchial, and pulmonary capillaries. Okay. So, as your lung bud develops, okay, the expansion is in a caudal manner, lateral, and even ventral. So, the book will say that it penetrates the primitive pleural cavity, which is also known as your peritoneal canals, okay, one on each side. If you make a cross-section here, please just remember this term, pleuropericardial fold. Your lung buds are here as they penetrate the pericardioperitoneal canals. Okay? Clear so far? further development of your lung bud would show you the appearance of your septum transversum. Now, the septum transversum supposed to divide the embryo, or it would divide, no? It would stay in the foregut to produce your thoracic and supposed to be your abdominal cavity. But the septum transversum cannot completely close the division because of the presence of your pericardio-peritoneal canals, where you have your developing lung buds. Okay? So going to the canalicular phase now, at this phase you will have the formation of your gas exchanging units. Okay? So there are three major events here. You have the birth of your sinus, continuous epithelial differentiation. So at this point, as also mentioned by Dr. Domingo, you will have a potential blood-air barrier. And it is also at the canalicular phase where you will encounter the type 2 cells which produces your surfactant. Okay, this is your terminal bronchiole. Each bronchiole can divide into 2 or more respiratory bronchioles, and these bronchioles can further divide into 3 to 6 alveolar ducts. Okay? So from tall columnar, at the early canalicular phase, you will have, again, epithelial differentiation. It becomes simple cuboidal. And towards the end of your canalicular phase, you will have the appearance of your type 1 and then the type 2 secretory cells. The connective tissue here diminishes, okay, because of the more intimate bonding of the lining epithelium with your blood and lymph capillaries. It is called the canalicular phase because the capillaries form canals around your epithelial tubes. When you look at the microscope, okay, medyo magulo pa siya, but if you will take a look, this is an example of your simple cuboidal epithelium. Okay? And then the red parts here would be your capillaries. Medyo dense pa siya. Okay? And this is to introduce you your type 2 cell. Okay? You have your type 1. This is the type 2 cell. Important here would be your multivesicular body, which carries your lamellar bodies. Okay? The lamellar bodies would have your phospholipid, which is the main component of your surfactant. Okay? So, we go to the saccular phase. The main feature here would be the initiation of alveolarization. This is from the 24th to the 37th week of gestation. So you'll have further subdivision of your saccules into subsaccules. And there's continuous or continued dissipation of your interstitium as you have more or extensive capillary invasion. So ito na yung saccular phase nyo, or it could also be part of your late canalicular phase. From cuboidal, it becomes your type 1 cell. Okay, and more intimate na ang bonding ng capillaries nyo through your thin squamous epithelium. Your type 1 epithelium is also your simple squamous epithelium. Okay? Simple cuboidal to squamous epithelium, which is also your type 1 alveolar cells. And again, at the saccular phase, some books would say that there's a double capillary network along the septae, meaning the supply for capillary per septae is 2. Okay? So because of this, you would have the progressive increase of your potential lung gas volume and surface area. Now, surfactant appears in the lungs in significant amounts by the 28th week. You have the appearance of your surfactant on the 20th week, but in significant amounts, it's on the 28th week. Now, at about the 34th week of gestation, or about 2 weeks before birth, your surfactant, okay, acts on your macrophages, which Dr. Domingos named as your dust cells. Okay? So these macrophages which have been activated will find its way through the chorion and into your uterus. Once in the uterus, it would induce the formation of your immune system proteins plus your interleukin-1 beta. Once you have these proteins, you will produce your prostaglandin. And what is the end effect? What is the effect on the uterus? It can initiate what? Contraction. So, ang punot dulo nito, it's the fetus plays a role yung sa kanyang birth. Okay? So, kanina you have a more dense picture. Now it becomes less. This is your terminal sac. Okay? Hindi nyo na makita yung cuboidal epithelium. It's type 1 and you have more blood vessels. Again, to review, at the pseudoglandular phase, you have your tall columnar cells. At the early canalicular stage, becomes cuboidal. Okay? Later becoming squamous type 1 cells at the terminal sac stage. Remember, your type 2 cells are encountered in the canalicular phase. Surfactant is produced at 20 weeks of gestation, significant amounts by the 28th week of gestation. And lastly, your alveolar phase. The main feature would be the continued alveolar development and proliferation. So this is from the 37th week through the postnatal period. Main events: further thinning of your alveoli, dissipation of your interstitium, and the division of your alveoli and the invagination into the septum together with your pulmonary capillaries. Okay, nawala na rin, you lose your double capillary network because the interstitium has decreased. Your alveoli would attain a polyhedral shape. And remember, when your baby is born, the increase in the number of respiratory bronchioles is not due to the increase in size. Okay, the increase in number is due to further subdivision. After birth, meron pa kayong 6 divisions that they will undergo. You only have 1/6 of the adult number at birth. Okay? So ito na yung alveoli natin. If you're asked to identify this cell, what is this cell? High power yan, alveolus nyo. This is your type 1, type 2. Type 2. Okay? Basta may mapula. Those are, hindi type 1. Red yan eh, the RBCs. Hanapin nyo dyan yung type 1 nyo. May RBCs dyan. Okay? Am I going too fast? Yes. Let's go now to the thoracic cavity. We'll start when the embryo is at 3 weeks, towards the end of the 3rd week, and we make a cross-section of the developing embryo at the level of your foregut. Okay? So the intraembryonic mesoderm would differentiate to produce the following mesoderms. First, your paraxial, which contributes to the formation of your somites and somatomeres. Then you will have your intermediate mesoderm, which contributes to the development of your urogenital system. And then you have your lateral plate mesoderm, which is responsible for the formation of your cavities. So, what will happen? Tignan nyo na lang to, class, okay? So, it will have a cleft here on the lateral plate to produce your parietal or somatic mesoderm. The parietal or somatic mesoderm is the one near your ectoderm, the blue. And then you will have your splanchnic or your visceral mesoderm, which is very near your endoderm, the yellow. Okay? This is your extra. The space surrounding it would be your extra embryonic mesoderm. Kasi the sides of the upper part of the parietal mesoderm would grow anteriorly to enclose the whole structure to form your ventral wall so that you will have your intra-embryonic cavity. So again, ito siya. This is your parietal or somatic. This is your visceral or splanchnic. Okay? The lateral folds will move anteriorly here. And as it does move anteriorly, the endoderm area also encloses to form your gut tube here. So eventually when this fuses, you will have the formation of your intra-embryonic cavity here. Okay? Ito yung parietal somatic, and this is your visceral or splanchnic mesoderm. They are continuous with each other by means of your dorsal mesentery. The dorsal mesentery suspends the gut from the posterior part of the body wall, okay, from the caudal area of the foregut to the hindgut. Now, when you have the closure of your ventral cavity, okay, hindi siya complete because it is open at the area of your midgut. Kasi andun ang inyong connecting stalk. And the gut also, when it closes, it's still open at the area of your midgut. Pero ang concentration natin is now at the area of your foregut. So are we clear on what happens to this structure? Okay, nag-fuse sila to produce your intraembryonic mesoderm. Meron na kayong parietal, meron na kayong visceral. That alone is a clue already bakit ang lungs nyo may parietal at visceral pleura. Okay? So the cells of your parietal or somatic layer lining the intraembryonic cavity now becomes mesothelial, and then it becomes the parietal layer of the serous membranes lining the outside of your peritoneum, pleura, and pericardial cavities. While the cells of your visceral or splanchnic layer would form the visceral layer of your serous membranes, which cover your abdominal organs, lungs, and the heart. Okay? Now, I've mentioned to you the septum transversum. Okay? If you have a dorsal mesentery, you would also have a ventral mesentery. The ventral mesentery comes from the thinning out of your mesoderm, of your septum transversum, mesoderm of the septum transversum. But towards the 4th week of development, okay, you will encounter this septum transversum. Ano ang significance ng septum transversum? It is the main precursor, it's here. It's the main precursor of your diaphragm, okay? It's the main precursor of your diaphragm. Okay, the septum transversum comes from the mesoderm of C3, C4, and C5 somites. Okay, as it develops, it pushes. Okay, it is pushed down by the developing heart, and the future thoracic cavity. Again, remember, the septum transversum is supposed to separate the body cavity into a thoracic and an abdominal cavity. Now, since it comes from C3, C4, C5, it brings along its own nerve supply, which is your phrenic nerve. Because your septum transversum will become your diaphragm. Okay? So remember, the lung buds expand caudally, laterally, into the pericardioperitoneal canal. So ito yung part na yon, class. Part of the septum transversum and the body wall was removed to show you the canals here. You see the arrows? It's open. So siya yung pericardioperitoneal canal. So that's why the septum transversum cannot completely close the thoracic cavity from the abdominal cavity kasi meron kayong pericardioperitoneal canals. Okay? So, remember yung kanina yung nag-cross section tayo sa lungs? This is your lung bud. Growing into your pericardioperitoneal canal. So during that time, you have here your pleuropericardial fold. Iba na to, ha? This is your pleuropericardial fold. Andito yung pericardioperitoneal canal. So what happens? Okay, from here, the mesoderm will give rise, yung mesoderm niya dito will give rise to a definite thorax wall, and then it will give rise to your pleuropericardial membrane, which contains your phrenic nerve and your common cardinal vein. Kita niyo? From here, this is the fold. Okay? The mesoderm develops to produce a thorax wall and your pleuropericardial membrane. Because the pleuropericardial membrane will fuse ito plus the root of the canal at this area. Kita niyo? Pleuropericardial membrane will fuse together with the root of the lung, so it will produce your pleural cavities and your pericardial cavity. Kuha niyo? From here, you have your folds. Okay, the mesoderm will give rise to your thorax wall and to the membrane. The pleuropericardial membrane would fuse, including the root of the lungs. So once it's fused, you will have the right and left pleural cavity and the pericardial cavity. Clear? So ano ang nag-separate ng pericardial from the pleural cavity? It is your pleuropericardial membrane. Hindi folds, membrane. Clear? Now, hindi pa rin completely closed ang thoracic tsaka abdominal because you have the presence of your pericardioperitoneal canals. Okay? So, how will this close? So, towards the 5th week, everything happens in a week's time. Huh? So, towards the 5th week, okay, at the caudal end of the pericardioperitoneal canal. Ito na yung canals natin. You see the blue structure? You will have the appearance of your you will have the appearance of your pleuroperitoneal folds. Kanina, pleuropericardial. Ngayon, you will have the pleuroperitoneal. So, tapos na si pleuropericardial. You will now have your pleuroperitoneal. Okay? It appears on the posterior wall. Okay? Towards the caudal end of your pericardio-peritoneal canals. So, what will it do? It will grow medially and ventrally to unite with your septum transversum and with the mesentery of your esophagus to completely close the openings so that from this point, separated na ang thoracic nyo from your abdominal cavity. Okay? Dalawang membrane lang naman, pleuropericardial and then the pleuroperitoneal. Tapos. Okay? Now, further development of your pleuroperitoneal membrane, okay, relative to the body mesenchyme, you will eventually have the formation of your peripheral rim. The red thing here, okay? So first, yung pleuroperitoneal fold, okay, unite siya with your septum transversum and the mesentery of your esophagus. Further development, you will have the formation of your peripheral rim. Once you have the peripheral rim, myoblasts from somites C3 to 5 will penetrate the membrane, your pleuroperitoneal membrane, to make it the muscle part of your diaphragm. Okay? What happens to your septum transversum? It becomes the central tendon. And the esophageal mesentery becomes the crura. Okay? Ito yung muscle. This is your tendon. And this is your crura. Diba? Pa-identify sa inyo opening. SEA. C-E-A. Caval opening. Esophagus. Aorta. Clear? Pwede may diaphragm na tayo. Now, some things you should know at the postnatal development. Mabilis lang to, no? Which corresponds or which I will touch on the upper airways, chest wall, and the tracheobronchial tree. At birth, you're supposed to have a large epiglottis, and your tongue is oriented horizontally. Your hyoid bone and your laryngeal cartilages are elevated, but over the next 2 years, the epiglottis, larynx, and the hyoid move downwards, and the tongue becomes vertically oriented. Okay? At birth, the larynx is at C1 level. At 6 months, it's at C3. In the adult, you will have the larynx at the level of your C5 and C6. Now, the epiglottis in the children are relatively large. They're omega-shaped, and they're floppy because there's not much cartilage. So because of this, it can even reach and cover the posterior oral cavity, including the soft palate, and it would encourage nasal breathing. Okay? So ito yung epiglottis ng baby, and this would be your vocal cords. Next, sa ribs. At birth, okay, they are composed of cartilage, and they are projected at right angles with the vertebral column. They are circular, and they lack mechanical efficiency. As compared, you know, when you assume the upright posture already, there's the action of the gravity, and from the circular rib cage, it becomes ovoid. So at birth, at right angles, circular, and then as you grow, may pull na ng gravity and becomes ovoid. Okay? Yung diaphragm nyo naman at birth, it has a decreased contraction efficiency because of the flat horizontal angle of insertion, and it is designed to suck chest inward rather than draw air into the chest cavity. So pag titignan nyo at birth, you have the triangle shape. Then, pag lumaki na, you have the barrel shape na. Okay? I'm almost done. Okay, so the tracheobronchial tree increases also in size. At newborn, the length is about 5 to 6 centimeters. At about 1.5 years old, it's 8 centimeters. And the adult would have a length of 10 to 11 centimeters. Okay? So the last part would be the developmental disorders and congenital malformations. Kita niyo yan? Na-notice nyo to? This is 6. 1, 2, 3, 4, 5, 6. Pati yung toes niya. 1, 2, 3, 4, 5, 6. Okay? Mga deformities. Yung iba nagkakaroon ng tail. Hindi yan sa harap, ha? It's at the back. Okay? First is the congenital diaphragmatic hernia. In general, this is located at the left side, posterior left side. So the problem here is the inability of your pleuroperitoneal membrane to do its function. So as the baby is developing, what goes inside that part of the lung area? Butas. So what comes in? Your gastric contents, okay, mga intestine nyo. And it could lead to lung hypoplasia on the left side. Kasi nakikipag-compete sa space. So sometimes the left lung will not develop. Okay? This is the normal X-ray of a newborn. But when you have the diaphragmatic hernia, kita niyo yan? The whole left side, you will have your, ito yung X-ray ng intestines niyo. Very high mortality para sa baby. Okay? Next, you will have the eventration of the diaphragm, meaning meron kayong muscle weakness. Hindi siya butas, there's no problem, but then the muscle is weak. I'm sorry, there's a problem, the muscle is weak. So, because it's weak, you know, the abdominal contents can still move up, okay, but hindi naman masyado. Okay? So you will have here, andito yung diaphragm nyo, you will have here your gastric contents. This is your heart. Next, pag nag-fail ang tracheoesophageal ridges, the tracheoesophageal septum, to separate the trachea from the esophagus, this is the most common tracheoesophageal fistula. Yung upper part ng esophagus ends in a blind pouch. This is the most common. You'll have other problems, other types of fistula. This film will show you the presence of your fistula. Ito yung right and left. Ito si yun. It's fistula. Okay? Yeah. This video is given to me by Dr. Bayawa. I'm sorry. Torres Guerra pala. Okay, next. Hyaline membrane disease. So pag premature kayo, okay, you lack surfactant, the air-water interface is so high that the lungs will collapse. But nowadays, you have already may surfactant na tayo. The last time I used it, it was 18,000 per vial. I don't know how much it is now. So again, ito yung normal, but when you have the radiograph of hyaline membrane disease, it's all white. We call it your ground glass appearance. Okay? So this is your normal lung pattern. Ano to? This would be your ducts. Diba? You will have your alveolar sac. Tama? High power. Ito yung type 1 nyo. Simple squamous. Meron kayong RBCs. Okay? Meron bang type 2 dyan? Mahirap na. Anyway, next. This is a picture, low power of your hyaline membrane disease. Okay? Pag i-high power natin, okay, ayan, you will see that the alveoli, okay, is lined by a protein material made up of dead epithelial cells and plasma protein which stains pink. Kaya siya hyaline membrane disease. Okay? So again, in summary, these are the most common malformations. When you talk about diaphragmatic hernia, there's a problem with your pleuroperitoneal membrane. Eventration of the diaphragm, there's a defective muscular development. Fistula, tracheoesophageal fistula, it's an abnormal partitioning by your septum. And hyaline membrane disease, kasi you have a premature baby, your preemies. Okay? My source, I only have 8 pages, 8 short pages, okay? It's taken from the Medical Embryology by Langman. This is the 11th edition, you already have the 12th edition. Okay? So just remember 3 terms, pericardio-peritoneal canal, pleuropericardial membrane, pleuroperitoneal membrane. Okay. You can go to your lab now.